Otokinetics, implantable hearing solutions. Let's review how we are hearing this. Sound waves are funneled into the external ear canal, impacting the eardrum, causing it to vibrate. 3 tiny bones in the middle ear transfer the vibrations into the fluid of the inner ear. A pressure wave then travels through the inner ear, stimulating microscopic hair cells in the cochlea. The hair cells convert these waves into nerve impulses. The impulses travel along the auditory nerves to the hearing center in the brain, where they are interpreted as sound. There are 3 types of hearing loss: nerve, conductive, and mixed. Nerve deafness results from damage to the inner ear hair cells located in the cochlea. Approximately 85% of hearing-impaired individuals have nerve deafness. Conductive hearing loss results from middle ear abnormalities that prevent conducting sound vibrations into the inner ear. And mixed hearing loss is a combination of nerve and conductive deafness. Hearing aids have proved effective for mild to moderate nerve deafness. As nerve loss worsens into moderately severe to severe deafness, greater sound amplification is required, producing several acoustical complications. Feedback, occlusion, distortion, and limited high frequency. 8.5 million people own hearing aids in the U.S. 1 million do not wear their hearing aids, and 3.4 million are very dissatisfied to slightly satisfied. 4.4 million hearing aid owners are discouraged, representing 52% of all hearing aid owners in the U.S. Crescendo has been developed for sensory-neural, conductive, and mixed hearing loss patients not satisfied with hearing aids, active middle ear implants, and bone conduction devices. Crescendo unique implantable technology bypasses both the external and middle ear, minimizing the problems inherent to hearing aids, active middle ear implants, and bone conduction devices. Crescendo's microactuator is implanted in the walls of the cochlea, directly amplifying the inner ear fluid, replicating the natural sound vibrations of the stapes. During the past few years, refinements in 8 separate technologies were essential to Crescendo's development. Piezoelectric crystals, 3D CAD/CAM microengineering, micro-milling of titanium, laser welding, implantable batteries, wireless technology, programmable DSP chips, telemetry. Microsurgical implantation of the anchor and microactuator is performed through the external canal. The eardrum is elevated and the round window is identified. A cochleostomy is performed with a patented guarded burr below the superior border of the round window. The anchor and microactuator are secured with unique insertion instruments. The surgical implantation is simple, consistent, and brief. Volume displacement in 10 microactuators was measured with laser Doppler vibrometry. Frequency responses are flat through 10 kHz. The equivalent sound levels delivered into the cochlea are 100 plus dB up to 1000 Hz, and increasing to 130 plus dB at 6000 Hz. The titanium anchor and microactuator was surgically implanted in the cochlea of 10 cats. Safety and biocompatibility was confirmed. Data was presented at the American Otologic and the American Neuro-Otologic Societies in April 2013. Accepted for publication in the American Journal of Otology. Otokinetics technology is protected by 18 U.S. patents, 13 issued, 5 pending. Crescendo 1 employs a state-of-the-art directional microphone and DSP technology. Instead of amplifying sound waves, Crescendo transmits radio waves from the external canal to activate and amplify the microactuator. Crescendo 1 is the shortest route to clinical approval. Crescendo 2, the ultimate fully implantable hearing system, is completely invisible. There is no external hardware and thus no activity restrictions. The titanium canister containing the microphone, programmable DSP chip, rechargeable battery, and radio frequency transmitter are implanted in the outer mastoid cavity. Facial nerve and middle ear bones are not disturbed. 360 million have disabling hearing loss greater than 40 decibels in their best hearing ear. 2/3 of these individuals are candidates for Crescendo. Crescendo technology is the future for sensory neural conductive and mixed hearing loss. Natural hearing with no hardware, no activity restrictions, no complex surgery, no hearing damage, and no feedback or distortion. Crescendo, the dawn of a new era in hearing technology.